Thank you everyone for joining us today at the Sussex Disability Sports Forum. I will just go through the running order as we've got some new people joining us today, so it's great. I'll give a bit of an overview around the Disability Sport Network and the previous forums we've run, and obviously highlight the aims of today. And then we'll open the floor up to the discussion on the topic of today's forum. We'll also have some key information around funding opportunities and support that's available. And we're grateful to have Richard Shenton here from the Caudwell Children's charity, so he's going to talk to us about one of their programs they've got at the moment, and then, as we do with forums, we're going to put it over to you guys and let you update everyone for a bit of networking and some key information sharing. So for those who haven't joined us before, thank you. I hope you enjoyed today's session. I thought it was worth providing a bit of background in case you're not aware, but the Disability Sport Network was established in 2015 and its main aim was to support the development and provision of disability sport and inclusive physical activity across Sussex. When we first launched, we had a steering group and we had 4 subgroups as well, and there's a couple of people on this call that were part of those original subgroups, but over time we kind of changed the structure to suit the needs of the network, and as a whole we now have 15 champions and over 750 people that are signed up to the network and receive the e-news. Events have seen up to about 50 to 60 people attend. And obviously when COVID hit, we had to move online, and we ran 11 virtual forums, which some had specific topics like today, and others were just there to allow a space for partners and colleagues to come together, connect and share as we navigated through all that ensured and is still happening. So today, as you would have seen, the title is around supporting low-income households and someone living with a disability and long-term illness. And we've looked at that given the latest rise in the cost of living. So we really wanted to focus on this topic, find out what might be going on in Sussex, sharing those experiences, sharing those good practice so that other people can hopefully learn from those, and also any challenges that are happening that you may have faced that other partners could help with. So following group discussions, we will hear about the related support, and we will also give some key updates. So at the end of the session, we're really keen that partners will be able to go away and consider how to support low-income families. Partners are aware of various funding and support opportunities that are available. We'll be able to find some funding recipients, and you'll have an increased awareness of key updates and what partners are doing on the ground. So moving on to the topic at hand, I thought it would just be useful to kind of set the scene. We know there is a wealth of research that exists outlining the benefits of being physically active and maintaining a healthy lifestyle, such as improving our overall health, quality of life, well-being and independence. However, many barriers can prevent disabled people from accessing opportunities to be active. This includes having the financial resources required for a minimum standard of living, and as such can affect whether someone can or wants to take part in various activities. On the slide, and we will share this information out afterwards with my kind of follow-up notes, but we can't report a change in terms of socioeconomic groups in the last 12 months. Basically, the least affluent groups, so those have a routine or semi-routine jobs, and those who are long-term unemployed or have never worked, is the only group to have shown a decrease compared to the November 2015-16 baseline, which is from the Active People Survey. So this reinforces the previous observed widening of existing inequalities. In terms of disability and long-term conditions, disabled adults and people with a long-term condition are less likely to be active than those without, with activity levels decreasing sharply the more impairments an individual has. However, until the coronavirus pandemic and restrictions were introduced, there were steady increases in activity levels among impairments, and as such, a slight narrowing of the inequality. However, the impact of the pandemic has been seen across all impairment groups, with an overall drop of 2.1% compared to 12 months ago among disabled people and those living with long-term health conditions who were previously active. Unfortunately, those with a disability or long-term health condition, we also saw no recovery across mid-March to mid-May compared to the first full lockdown during the same period. This suggests a return to activity may be slower for this group, and without additional support, many may not return. Although the majority of research around the relationship between disability and poverty and activity levels among low socioeconomic groups is for adults, the Active Lives Survey for children and young people does provide a little bit of insight. Although the latest data shows that the activity levels among children and young people with a disability or long-term health condition are actually the same for those with one, those from low affluence families are the least likely to be active. We can therefore assume that disabled children and young people from less affluent families, so low-income households, are more likely to be less active. I thought it might be worth highlighting at this point kind of some of the definitions around low-income households and poverty. So a household is in low income if they live on less than 60% of the UK's median income. So for example, a couple with no children would be in low income with an annual household of up to 17,000 before housing costs and 14,800 after housing costs. Although most define fuel poverty as simply not being able to afford to keep your home warm, there is an official definition. A household is said to be fuel poor if it has above average energy costs, and if paying these costs would push it below the poverty line as far as its remaining income was concerned. All this information is available on the government website. So again, I'll send links with the follow-up so people can go and have a look at more of the information and data that's available if that's of interest. Just to note as well, on the slide, there is a screenshot from the Activity Alliance report, which talks about poverty among disabled people. So again, we'll send that report out so that you can have a look in more detail, and it gives more breakdown around numbers and percentages of disabled people and poverty. So I'm hoping that that gives a good kind of starting point with the discussion, just to kind of think about those young people and adults and and those families and individuals that we may be wishing to work with. So I'd like to now hand it over to you and for you to think about any good practice examples and what might have worked working with low-income families or people from lower socioeconomic areas. And if you are working with disabled people from those groups, how do you know and have you gathered this insight? And what, if any, challenges have you found to engagement and to delivery? As you know, the Disability Support Network is a place and a space for people to share and learn from each other. And we often find that a partner has a solution that can help someone else. So please be open and honest and help those on the call. So over to you. Who would like
Me.
to go first?
Me.
Christy, is that you?
It's Loretta. Hi, I'm in a
Loretta.
slightly better area now. I've come to the very end of a wall here, so hopefully it's not too noisy. Is there too much noise, Gemma?
No.
Background noise? No, good.
Fine.
Okay, excellent. Right, so most of you probably know Defiant Sports already. Some of you newbies might not know us, so hopefully you will do soon. We predominantly work with people with disabilities. A lot of our sessions are free because we seek funding from everywhere, including Gemma, quite regularly. And we get a lot of support from Active Sussex, but also the national governing bodies in sport. So we do find that money is a big issue. So I'm really interested actually in the slide you were just talking about with the poverty and disabled people, because that's not data that I've had previously. So that'd be really useful, especially to give to funders. We run tennis, basketball, dodgeball, cricket, football, bocce, curling, pretty much anything you can do in a sports hall. So one of our long-term successes, I guess, is our visually impaired tennis. So that's been running since 2015. At the moment, it's been free. From next month, we're actually having to start charging £2 per person, which is it's a bit of a shock for them, and it might not sound like a lot of money, but we know that it is a lot of money to people, especially when people quite often have to travel quite a long way to get to the sessions because they're not necessarily that common. But actually, I put a message out yesterday with gritted teeth and told them that we're going to have to start charging, and everyone's come back with a very positive response. So I think the biggest take that I would say is that if you're honest with the people you're working with, they're far more likely to support what you're doing if they know that you're there for the best interest. So all of our members are quite happy to pay their £2 per person per session, which clearly isn't a lot. We do try and seek input from them. So rather than us prescribing what sessions we do, we ask community to give us input on what they want. And I would say that's really important, because I think there's far too much of people being told what they should and shouldn't do. So for us to say to them, what do you want to do, works really well. But yeah, just a little bit of input from me, but always happy to answer any questions, either chat to people or drop me an email if anyone's just starting up or trying to get something going, because we'd love to see more of it about. So I will be quiet now and let everyone else have a little chat.
Thanks, Loretta. No, that's really good to hear. Thank you. Would anyone like to go next? Jackie.
All I was going to say is, and I talked about it this morning, we have a lovely inclusive family fun day. It's at Moscow Leisure Centre. Moscow is in East Brighton, essentially an area of socioeconomic deprivation. But the people who come to the fun day, which is free because we've got funding from Active Sussex, it's not the local people that come. It's such a shame. They're coming from all over Brighton. We got, car parking, access, and I'm working on how to engage with our local community, because I don't know if they see this big leisure centre and think it's not for them. I don't know. I'd be interested in what other people think.
So Jackie, how do you know that those individuals aren't from the locality? Is that from filling out forms they have to kind of give their...
Yeah, we take postcodes and we chat to them as well. And without wanting to be politically incorrect, I know, because we chat to them. We've done 5 now, so we know most of them. But yeah, they fill in a form with their postcode on as well.
Okay, thanks, Jackie. Christy, I think you'd like to say something.
Yeah, I'm just starting up because of COVID. I qualified as an exercise and music instructor in 2019, then COVID happened. So I haven't been able to get out there. I just started in November. I specialise for people with disabilities. I can't do chair-based because I'm not trained yet, but if people can walk, visually impaired, blind. I have tried the local charities because I'm actually visually impaired myself. I can see body shapes and colours. It's just people's faces at a short distance, and that's why I'm qualified and allowed to do what I can. So I'd like to get in touch with as many people on this forum today. I need to get into venues. Active Rother are funding me for a while, but until that funding runs out, I won't be able to get into venues because the high costs of paying £20–25 per hour really inflicts on what I do. And I'm trying to keep my costs low so that people on low wages and benefits, at the moment, my classes are £3 per person. I want to keep them at that rate, providing I can network with as many people as possible today. Get into venues, I can do my classes in residential homes, people have got special needs, mental health. I'm out there because of my own needs and my own experience of working in the disability sector. I understand what I call special people, special needs and special adaptations. So if you're interested in what I do, Angie's got my details, and I'd love to work with as many people as possible. As long as I earn a reasonable hourly rate, I'm okay with that.
Thanks, Christy. That's really interesting. I think it's what you're saying about the facilities. That is something that's coming up in quite a lot of our discussions, and in the Equality, Diversity, Inclusion Steering Group meeting we had yesterday, that was also mentioned. We're going to be touching on something about that later on in the presentation, and around capturing some of those kind of unmet needs and some of those barriers so that we can help the network. So thanks for raising that, and hopefully it's something we can start help to address.
Oh, can I just ask, how do you become a disabled person's champion?
I'll email you.
Thank you very much.
No problem. Would anyone else like to? Sorry, I was just reading a message from Paul. Would anyone else like to, to input in this point?
I've got a couple of questions actually that I wondered if it's things that I've seen in other kind of localities, and it's whether it's something that's similar for Sussex as well, and that often when we're working with people from lower socioeconomic groups, they are more likely to not put themselves within the category of being disabled, or don't identify as being disabled as the kind of communities might. So it's whether that's something that is posing a challenge, and how we can, you know, make sure that our sessions are truly inclusive rather than putting on specialist kind of disability sessions that are targeted at this community. So yeah, something to consider for that. And yeah, it's where yeah, I suppose that's probably where I want to start and see if that's something that I know you must, Jackie, you're just nodding. Is that something you've seen as well? And I suppose it's the cost. You're saying about charging, you know, a couple of quid, or what do people do? Or if you do get funding and you go in and charge nothing at the beginning, and then when that funding runs out and you have to put in a small charge, is the drop-off rate just what happens essentially? Because what we've seen elsewhere is that people it's just too much. Even just a couple of quid is too much, because what you're saying about people having to travel to the right places, or you know, even just making sure they've got to pick up one kid from one place and be in another place for another child at the same time, and it's just the logistics of it's just too difficult. So it's how we can make it as easy as possible.
Thanks, Nicola. Yeah, I don't know if anyone has any thoughts against those of how that. I know Loretta, obviously you've mentioned what you've done, but yeah, in terms of kind of sustainability, if anyone's got any examples of what they've done in those instances. Oh, Paul, you've got, oh, both Paul, we've got Paul Taylor and Paul Turner have got their hands up. So are either of those a response to Nicola, or are they just chipping it? No, nodded. No, okay, all right. We'll keep thinking, and if anyone has anything to input on that bit, we can come back to it. So Paul Taylor, do you want to go first?
Yeah, hi everyone. Yeah, Paul Taylor, I'm the Sports Development Officer at Horsham District Council. I was just going to share the fact of we in Horsham District have sort of got a reasonable track record of running events and activities for people with additional needs. So our Ready and Able Adult Disability Sports Club's actually been running for 30 years. And then our Reaching Higher project, we started in 2009 through funding from West Sussex County Council. It's now the short breaks funding. But I was just going to make the point of, where you can try and sort of, provide maybe a reduced rate. So we link in, internally at Horsham District Council have got a leisure access card scheme that people on lower incomes and we're talking about disability, they should be able to access that, should be able to sort of get a leisure access card. So we offer a discounted rate for those that take part in our activities. But there's also the West Sussex Compass card. I know that's changing from the 1st of April, but again, another opportunity for people, because I know a lot of people across West Sussex have got that Compass card, and it does enable them to get obviously sort of discounted rates. So it's worth looking at that aspect. So we do provide that for sort of our Reaching Higher project. Our Adult Disability Sports Club, we've just after 30 years gone up from £1.50 to £2. That's an hour of sport and a swimming session, which, it is obviously a cost, but I don't think it's that much for people to sort of to sort of like pay. And we haven't necessarily, there's no one that's sort of, dropped out as a result of a 50p increase. And we've actually found that since COVID, numbers were sort of quite low coming back to the Ready and Able Club at Christ Hospital on a Monday evening. But I think last couple of weeks, there's some sort of like some homes and some groups that bring some young people sort of like direct to the sort of session. They've started coming back. I think possibly the relaxation of the rules and sort of Boris's announcement and stuff. I think people are now sort of accepting that we've just got to live with sort of like things. And we've seen an increase in the numbers of people attending.
So Paul, were you saying that people are being transported there by an organisation?
Yeah, so there might be a specific home that are bringing sort of 4 or 5 people. They weren't coming and haven't been since obviously COVID, but in the last couple of weeks, so last week and then Monday this week, we've seen them returning, bringing those young people where they hadn't been doing that, even though we've been running the face-to-face for quite a while now.
So just on that, and maybe almost reflecting pre-COVID as well, do you find that having that transport has helped to get people to those sessions?
And you're reliant then obviously of the people being available to do that. I think transport is an issue for a lot of people. So if you can get a coordinated group come in and you can link into that, then that works. But obviously the Horsham district is quite spread out, and transport is an issue to get sort of like places. So when you're looking at locations and to run activities, can you think along where it's easy, maybe linked into public transport near a train station? So for Horsham, we do some bits at Collier's, and that's obviously not far from Horsham train station, and we have found people that do link in that way and come to the session.
On the point around the cards, we've, like for instance, Freedom Leisure have got a card that kind of works well. Do you kind of review the postcodes and where people live that are accessing that card to then look at where the gaps are, and then putting something on in a locality so it better serves that community? So
there was so leisure access card has been running. The Horsham District Council have had that for probably about sort of 10-15 years. It hasn't been fully looked at recently because whoever was in charge has sort of like left. But I know Mike Hart, who's sort of recently joined our sports development team in December, who's on this call. He's been tasked as part of his new role as the sports activity officer to take ownership of the leisure access card, and that'll be one of the things that he'll be looking at doing, is reviewing where people are and trying to increase the number of opportunities that and sessions that are available through that leisure access card scheme.
Okay, great, thanks Paul. I'm going to hand it over to the other Paul now.
Sorry, I was late, and then I couldn't make my volume or video work, so sorry about that. I suppose, so I'm Paul Turner, I'm from Mid Sussex District Council, Community Services Manager there, and I manage the Health and Wellbeing team and a small Community Services team. And I'm really thinking about events. We do quite a few play days and community events throughout the year for families. And the idea is it's free of charge. They can all take part in the activities in their local area. And what we're trying to do in the Easter period is encourage children back into kind of sport, physical activity. And so we're running a number of events with either kind of local sports providers. So I have a new kind of concept doing that. And that's on top of our play days, which are kind of out in the community, because we're quite a rural area. We try and focus these play days, about 10 or 11 of them, in areas where you don't tend to get a lot of participation locally. So sort of more of our rural parishes, communities. And that's been working really well. Really excited to do the kind of encouraging back into kind of physical activity. But what's missing is kind of, I suppose, the accessibility for disabled people, young people to take part in stuff. We tried to make things accessible as possible, especially with our play days, so that all can come and enjoy them. But yeah, the thing I've noticed in terms of the sporting activities that we're trying to do at Easter, there's kind of that missing link. So I suppose it's just a plea, if anyone has kind of knowledge or information or involved with that sort of activity or sports for people with disabilities, then love to hear from you. We have a Better Young Lives network that Sally, my officer, manages, which is a Mid-Sussex network, which is really popular. Again, if you want to come along to that and be part of that, that'd be great. Yeah, it's just a plea really, if anyone's got any information or knowledge on those types of activities, love to do it. We've done quite a few things with our leisure centres, you know, like activities for young people and adults, in terms of like parallel games, disability swimming, that sort of thing. But again, out in the community, I'd love to encourage a bit more of that into areas where it's not readily accessible. Yeah.
Thanks, Paul. Well, right at the end of the session, we will open up to kind of partner update. So that'll be a bit more of a round table chance for people to introduce themselves and give a bit more on what they're actually delivering, and hopefully can make some networks via that.
Super, thank you.
There's a few things in the chat. If anyone else wants to, I've got Marie. Yeah, so the compass card, she's just highlighted around the compass card in Brighton and Hove. So that's continuing, working with leisure providers, send age 0 to 25. We go to school, live in Brighton. We can promote activity providers to disability register in Brighton Hove. Marie, I'm not sure if you're there, but as I mentioned when Paul was talking around Horsham, are you able to kind of break down and have a look at the sign-ups to that and understand who is actually accessing activity, or is it the providers that deliver it themselves would then obviously have to look at that data?
Hiya. I won't talk for long because I've got COVID and I keep coughing and my voice keeps going. Just update, Compass Card in West Sussex is ending at the end of March, and West Sussex County Council are taking it in-house, but Brighton and Hove is continuing unchanged for the time being, so that's all fine. We do hold that information, so we hold the disability register. Obviously we won't for West Sussex anymore, but we do still for Brighton and Hove. And we can break down all these kind of things. If anyone looks on our website and looks at the registration form for a child or young person to go on the disability register, it does ask an awful lot of information, but that is so that we have really valuable data that can help with planning. So if any providers are looking to plan activities, we can provide data. So we can look, you know, at income, we can look at the types of disability, we can focus on areas. So I know Jackie was saying in particular about the Moulsecoomb group, you know, we could do targeted emails to families in Moulsecoomb or particular areas. So we do have that information, we can access that, and we can do targeted mail outs if needs be.
Great, thanks so much, Marie. I'm sorry you're poorly. Hope you feel better soon.
Thank you.
What else have we got? GP referrals, health membership. Yeah, I guess that's, you know, it's looking at those other avenues to get to those individuals within those communities. And we are doing more with social prescribing and obviously GP referrals. So hopefully that will pick up, and in terms of highlighting the opportunities and the benefits that are there for physical activity along with our health professionals, starting to kind of cascade. And Nick, who's our strategic workforce officer, is doing a lot of training and support with the health professionals around that at the moment. Did anyone
can I just ask, the social prescribing,
yeah,
is it kind of postcode lottery? It depends on where you live and the surgery, because where I live in Bexhill, this isn't going on. And as far as I'm concerned, we need a social prescriber in every GP surgery, so that when people come to their GP now, and GPs need to look far ahead, it's not only a GP surgery, a medical centre, but where you can point people in the right direction. Because a lot of people just do not know all this is out there, and they need to know about what's going on to help them have a better quality of life for all sorts of reasons. So I hear a lot about social prescribing, but I don't actually get any of it, quite frankly. You know, it depends where you live, it seems.
So yeah, and Ross and Nick, feel free to jump in because you've been doing some work with Bexhill kind of PCN, but from an overarching point of view, social prescribing is very different across the UK. Some GPs and PCNs have taken on that and delivering it out of GPs where possible. In other areas, it's delivered by a local organisation, so a charitable voluntary organisation like Age UK. So it does look different in every place. I thought there was obviously social prescribers covering kind of the Bexhill area. So I'm looking at Nick and Ross now, because I think you had a conversation recently. Oh, sorry.
Correct me if I'm wrong, Ross, but isn't it South Down cover that area, so that you should have some social prescribers working across the Hastings and Rother area, including Bexhill?
Yeah.
So
South Down, and in terms of Bexhill PCN, I think the main contact there is somebody called Simon Daneski. I haven't had any direct contact with him myself. It's been quite difficult to engage a lot of the social prescribers over the last year or two, and an additional struggle to try and push physical activity up the agenda as well. So yeah, there are a couple of contacts that we can send you.
Please.
Yeah, and we'll yeah, do all we can to sort of try and link you in as well. But it is still a challenging area for us as well, and we are trying to sort of build those relationships across the whole of Sussex, but it's not easy at the moment.
Could you send them via Angie to pass on to me, please?
Yeah, sure. I think some of it as well, Christy, is the social prescribing kind of was launched, and COVID obviously has meant that a lot of those individuals who were in those positions were put then into COVID specific roles and reacting to that and helping with vaccines. So I think as we're moving out and we're starting to move back to a bit of normality, I think we'll start to see a bit more traction from that as well. But yeah, we can help to try and make some contacts there. Thank you.
Thank you. Thank you.
Right. Before we move on, I'll just check, did anyone else want to add any other examples of good practice or challenges that you've faced? No? Great. What I'll do then is I'm going to just reshare my screen. Someone can tell me that you can see my screen. Yeah, fab, thanks, Andy. Brilliant. So just before we go on to hearing from Richard, I thought it was worth just highlighting a couple of kind of documents and fact sheets and resources that are available. So the Activity Alliance, I don't know if many of you go onto the website, and I know they are going to be getting a new website at some point, but there are lots of resources on there, and they did create a fact sheet. I think it's number 11, and it's supporting low-income households to be active. So it draws on data from the 17-18 Sport England Active Life Survey. So I know obviously we've had previous, we've got later data, but some of it is obviously still relevant. And it also draws on the Family Resources Survey from 17-18. So the guidance is still very much applicable, and if not kind of more important, given the return to activity may be slower at the moment, or like we heard, not at all without additional support. So this fact sheet provides insight on how deprivation affects some disabled people's lives, and it explores the relationship between poverty and disability, and how both the causes and consequences of deprivation can impact a person's desire, choice and opportunity to be active. I won't list kind of the topics, but they're you know, that there's some key topics that it covers, and also looks at kind of considerations for successful engagement and delivery. So alongside that fact sheet, there's also a resource that was launched in September 2020 called Taking a Person-Centred Approach. And that explains the concept of intersectionality in relationship to disabled people, and how this can influence their activity levels. And what it's really kind of hoping to do as well is encourage sport and leisure organisations to take a person-centred approach when planning and providing opportunities, which I'm sure a lot of you are doing already, but it's really about kind of pushing that point that we should really be focusing on the individual and ensuring that what's being offered is taking their thoughts and needs into consideration. So stop hearing me whittle on for a bit. And I'm now delighted to hand over to Richard, who I'll leave to introduce himself. So Richard, just let me know, yeah, carry on with the slides, please.
Thanks, Gemma, and thanks, Nick, as well, for the opportunity to speak to everybody down in Sussex. I'm in North Staffordshire, South Cheshire border, so hopefully you can hear me in this echoey room and also understand my northern accent. I appreciate I'll stick out like a sore thumb a little bit. Sort of today's presentation really is around just briefly explaining what Caudwell Children do. We're a national charity for young people with disabilities and young people with autism, and how we're trying to sort of reach out regionally, I suppose, through the Active Partnership network. So I'll sort of go into detail with that as well. So a bit of the presentation about what we do, a little bit of the presentation around Sport England statistics with the young people that we work with, which I'm sure you're probably aware of. And then just I'll briefly discuss the actual sort of project we're looking to do nationally as well. And then obviously any questions after that. So you're going to go on to the next page, Gemma. I think you may have to press it. Yes, there we go. Two more times. One more time. There we go. Brilliant. Apologies for that. So yeah, so our sort of strapline is whatever it takes, really. So we've been a charity in existence for 21 years now, since 2000. The reason I mention our benefactor is several reasons. So John Caudwell, who owned Phones for You back in the day, if anybody can remember those awful adverts that we were subjected to, he sold his business. I think his net worth is about 1.8 billion, something like that. The reason I mention all that is not to brag. It's he's pledged to give pretty much most of his wealth away when he sort of passes away, effectively. He also funds the charity as well every year. So as a charity, we have operational costs like every other charity, but that they are funded by John Caudwell. So any money that we raise goes straight into the cause, and we also try and create £1.40 from every pound that we raise. So we try and give that additional sort of 40 pence to the money that we raise. So we're fairly unique in that, in terms of nationally, that we don't have any operating costs to service with the money that we raise. Over those last 21 years, we've supported around about 50,000 children and families, and provided in excess of 50 million now of services. And the range of young people and their medical conditions and disabilities are vast. So they go into 650 different sort of medical conditions as well. So, like I say, the main crux of the charity is young people with disabilities, supplying chairs, equipment, car seats, and also sports equipment as well, which is why I'm here today talking about that. So we also have a special fundraising project for young people active in sport, and they require a new chair because of age or it's broken and things like that. So you're okay to go on to the next page, please, Gemma? Brilliant. So this is the sort of centre that I'm sat in today. I'm very envious of everybody at home by the looks of it, working from home. Unfortunately, we don't have that benefit here, so it's quite a strict policy of coming to the office. But we do have plenty of space, which is good. The reason I'm sort of showing the picture of the centre, really, we're based at Keele University, up in North Staffordshire. Most of that centre is a medical centre. And we found that a lot of the young people we helped fundraise for with young people with disabilities. Also, we're struggling with their families with young people with autism as well. So we raised over £80 million to build the centre, and we now have this amazing building to assess young people up to the age of 25 for autism. And what we found is nationally, you can wait between 3 and, believe it or not, 10 years for a locally funded autism assessment for young people. Obviously, that's critical in terms of within their education system to be statemented in that way, especially with the transition year of 6 to 7. So really, the education system can understand young people with autism. Without that statement, they can get misdiagnosed with bad behaviour and all the things that go with that. So we fully fund, or up to 80% fund, assessment centres, assessment for young people with autism, and that's nationally as well. So we have lots of people within Sussex that come up as well, and we provide that service for free. The total cost for each assessment, I think with the local authorities, about £2,000 to £3,000, but we go sort of beyond that. So each assessment costs £5,000, but it also has plenty of wraparound services as well for that. Lots of touch points after the assessment to ensure that families can understand the assessment and what that means for the young person and their family going forward, and also to provide different services as well. So we also have a digital skills programme for slightly older young people, which then helps them into education and employment as well. So we have lots of wraparound services, and also warmer homes as well. We have a programme which, obviously, listening to everybody talk about how finance can be an issue with accessing sport, and certainly is an issue for families with young people with disabilities accessing sport because of the costs. We find that over 20% of the families that we work with are in a situation of eat or heat, heating their home. So we also provide funding for warmer homes as well, to ensure that the basic necessities of young people with disabilities are met. So that's the centre. If you've got the next slide, please, Gemma. Okay, the next sort of 2 slides really are just to illustrate who we actually work with from the Sport England perspective. So I think this study is fairly new. I think it's last year. So within the autism spectrum condition, ASC, I think we like to use rather than ASD now. We sort of work with that section really of 0 to 17-year-olds predominantly. So as you can see, within the sort of disability fraternity family within the UK, it's a very small number of people that we actually work with or access to and try to help. So we try and sort of provide around about sort of 2,000 autism assessments each year. Like I say, it's quite a sort of niche area within the disability family. If you just go on to the next slide, please, Gemma. And the project I'm about to sort of talk about, just to give it some context, obviously, I think it's about 36% of people who have a disability have a sort of mobility problem. The percentage, I found this quite a shock really, that use wheelchairs is really small within that. So only 5% of disabled people within that sort of population actually use a chair, and that's the young people that we help to fund new chairs that can get the young person to stand fully when they're talking to somebody, and also within the sports chairs as well. So those sort of figures give you an idea of the pool of young people that we work with nationally. If you've got the next slide, please, Joe. Okay, I think just, yeah, give it a couple of clicks, that's brilliant. Okay, so with the actual project that we linked with the active partnerships, so I'm currently working with 18 active partnerships now out of the, I think, 43, who very kindly responded to my email at the beginning of January, and we're going from there really. We've got £500,000 worth of funding from Edward Gosling Foundation. It's very specific, it's over 5 years, and it's a match funding programme. So I thought nothing better to go out to the active partnerships to really identify young people within each county that are currently playing sport and need to access better equipment, newer equipment, or to replace existing equipment to carry on their sport. And it's at club level all the way up to elite level as well. So we fund Paralympians all the way down to club level players as well. And the idea is that Edward Gosling will fund 50% of a new chair, say for example a new basketball chair that may cost £3,000 to £5,000. So we can match fund say £2,500 for that, and then we're then going to work with the identified young people in the county to either fundraise themselves, and we'll give them plenty of examples of how to do that, or try to match them up with local funders. And we've had a bit of success already within the few weeks of launching this, where we've matched up with local funders and they've got the funding pot straight away, which is brilliant. There are a few conditions, so we're looking for young people up to the age of 25. Like I say, they've got to be active within a club sport at the moment, because we do require a reference from a sports coach to say this young person has come for a while and they need a new chair for X, Y, and Z reasons. You've got to be a UK resident, and obviously talking within low income housing and disability, the parents or guardians or themselves, if they're over 19 and aged under 25, have got to be in less than £45,000 as well, which doesn't exclude a vast amount of families that we currently work with, but that does exclude their disability benefits as well. So it's effectively earned income from work. So they're the sort of few stipulations that we do have when we identify the young person or young persons locally. Got the next slide, please, Gemma. So the sort of call for action really, I'm sort of working closely with Gemma and Nick at Active Sussex, and the idea is that we'll sort of be put in front of clubs or people within this call today that will know a young person that is performing sport at a particular level and needs access to a new chair, new sports equipment, to take them on to that next level or to carry on the sport that they're doing effectively. So if you do know of anybody that matches that, we do have, I've sort of allocated around about sort of £5,000 to £10,000 worth of match funding to Active Sussex. So, you know, we could quite easily fund 3 to 4 young people within the Sussex area to try and match fund them. And like I say, just make sure that they do have the match funding criteria as well. There is a sort of e-leaflet that I can send out via Gemma and Nick if you do need any further information on that. But really, the sort of call up to action is, do you know of young people that are looking to fund a new chair or new sports equipment? And so we can certainly half match, 50% match fund straight away, and then also help them to fundraise that extra 50% as well. I think there's one more slide, yeah, I think. If you just flick through. Yeah, brilliant. So yeah, that's pretty much reiterating what I've sort of just said, really. So the target is to maybe allocate around about £10,000 from the Gosling Foundation. Hopefully that will help sort of 3 to 4 young people to get new sports equipment or new chairs as well. Also, if you do know of any local funders as well, we do link quite well with the network foundations. I think there's 47 of them as well. And quite a few of them have come forward already and said, yes, we can match fund the second part of that 50% as well. So the young person's got the money there and then. So yeah, if you do know a young person within that sort of sporting context, please get in contact with Gemma or myself directly. Gemma will supply the email details. Yeah, and that's the project in one really. Any questions?
Thanks, Richard. That was really interesting. Yeah, and I'm really hopeful the network will be able to help identify some recipients. So yeah, if anyone's got any questions, we've had one in the chat box asking, would it include things such as goals, kit, transport, etc.?
Yeah, unfortunately, it's not. My plan next year is to get some unrestricted funding on the back of this, really, Rich. So the idea is it's just for individuals. So the reason we do that is because the individual has to make the application, and that's why we ask about the family income. It's not like a mortgage application form, but it's just a few questions about their income and things like that. We're obviously trying to really pinpoint this funding for families that are financially struggling, really. So yeah, unfortunately, it's not about that. But in terms of transport costs, Rich, what has happened is that some young people that have already raised some funding through a GoFundMe page, the second funder have said, right, you keep that money for all your transport costs, and then you can use the money that you've already used for that, and we'll 50% match fund with Caudwell. So it sort of does help with transport costs if the young person is already on that funding journey.
In terms of transport costs as well, I mean, that could be kind of that individual getting to and from the where the sport's taking place or whatever, and kit for the individual. So with that,
yeah, absolutely, Rich. Yeah. So I've got one example in Cumbria where a young person had already fundraised £2,000 to a £6,000 basketball chair. We got in touch with a local funder in Cumbria, and we, between those two, ourselves and that funder, will fund the 6,000, and she's getting to keep the 2,000 for hopefully 2 years worth of transport costs.
Great, thank you, Richard. Did anyone else have any questions for Richard? Like we said, we will share the details and Richard's details, so you can follow up with any individual inquiries. Sorry.
Hopefully I was on time with that, Gemma. That's good.
It's me, because I'm terrible with my timing. So brilliant. I don't think, yeah, it doesn't look like we've got any more specific questions, but hopefully some food for thought and something for people to go away with a bit of a call to action as well. So thanks, Rich. Thanks so much for joining us.
My pleasure.
We're now going to hand over to my colleague Russ.
Thanks, Jem. Perfectly on time, so I feel under pressure now. But for those of you I haven't met before, I'm Ross Joanidis. I'm one of the strategic relationship managers at Active Sussex. I've got a focus on long-term health conditions and older people, but I've also been overseeing the Together Fund over the last couple of years. And so with that in mind, we just wanted to give you a bit of an update on some of the funding that has gone out, particularly supporting disabled people over the last couple of years, and some other funding opportunities that might be available going forward. But before we do that, we're just going to give you a very quick update on Sported and their intention to work more closely with partners who are supporting disabled people into physical activity. So Jill Robertson, who is the Southeast Regional Manager for Sported, was hoping to be part of the session today, but unfortunately she was unable to make it. And for those of you who don't know Sported, they're a UK-wide charity providing sort of equity and fairness for young people through grassroots physical activity and sport. And they do this by providing resources, expertise, sort of operational support, and in some cases funding as well. So following the discussion Gemma and I had with Jill a couple of weeks ago, they're keen to work collaboratively to support young people with a disability from low-income families. So they're hoping to have some additional funding to do this, but they're just waiting to see how much this will be and what the offer will be, and particularly around that sort of sustainability aspect of it beyond the initial funding. So once we have more information from them, we'll be able to share it with you. In the meantime, we also wanted to highlight their recent community facilities thought leadership report, which shows that groups not having access to facilities has had sort of delivery, resilience and funding implications. And this is what we were sort of touching on earlier, right? That knock-on effect that is that shows that inequalities do exist with those where you don't have your own facility, or you don't have sort of funds to book those long-term slots. And through that, those inequalities are just worsening. So based on this, and in light of sort of several conversations that Gemma's had with members of the Sussex Disability Sports Network around facilities, and some of the barriers and issues that you're currently facing, we're going to be sending out a survey to sort of try to better understand those unmet facility needs. It is something we're really keen to feed back to Sport England on, and also see if any of our funding can support this issue, whether that be through sort of funding opportunities. We had the Open Schools Facility Fund last year, which our colleague Andy Wright was managing, and possibly even some of the Together Fund, which I'll touch on in a moment as well. And in terms of timings, we're hoping to get that out to you over the next few weeks, and we'll be encouraging you to share that with partners as well. So can we go to the next slide, please, Gem? Thank you. So, Active Sussex have been overseeing the aforementioned Sport England Together Fund in Sussex, which, as some of you will know, was previously called the Tackling Inequalities Fund, not to be confused. So this was funding that was initially given to us 2 years ago to address inequalities that had been exacerbated by the early impact of COVID. And the funding was to support partners to reach one of 4 priority groups, which were people from lower socioeconomic groups in areas of deprivation, people living with 1 or more long-term health conditions, disabled people, and people from ethnically diverse communities. In total, we have allocated just under £344,000 through the Together Fund and made 43 grants that have reached disabled people. So some of these have been activities specifically targeted at disabled people, and some have been inclusive sessions which have engaged disabled people. And in total, £79,000 from that funding has gone into projects supporting disabled people. And because disabled people and people with long-term health conditions are present in every neighbourhood, this aspect of the funding was less targeted geographically and relied more on the presence of providers working with people in these groups. And when we look at sort of disabilities and long-term health conditions combined, these 2 priority groups tend to be overrepresented along most of the coastal strip, and some small pockets inland as well. I'm pleased to say that since the first phase, we've successfully applied for a further 3 rounds of funding and are now just about to go into phase 4. Funding for this phase will need to be allocated and spent by the end of March 2023. And the main difference for phase 4 is that there is more of a requirement on us to address gaps in provision up to now. So we need to be looking at those locations, Arran, Chichester and Wilden, to name a few, where we haven't funded as much activity. And also looking at some of the subgroups within the 4 main priority groups. So for long-term health conditions and disabilities, that might be funding projects that are more condition specific. So while we've funded a lot of projects that cater for a wide range of disabilities and long-term health conditions, we haven't funded many that target a specific disability or condition. And one of the major findings from our evaluation of the projects we've funded up to now is that to reach a certain group, you really need to target it and adapt the offer to their needs. And if you really want to engage them, that activity needs to be specifically targeted at them. And I appreciate I'm talking to the people that already know that, but that is our challenge going into phase 4. It doesn't mean we don't want to fund other projects or partners we've already funded, but we just need to make sure that while doing that, we are also being a little more focused and targeted and prioritising what we need to be funding in phase 4. And really, we just want to sort of build on the great work that's already happened through the funding allocated in the first 3 phases. You can find out more about this in our Tackling Inequalities Fund report, phases 1 to 3, and also on our Tackling Inequalities page on the website, which allows you to sort of search for grants by area and priority group, and also shows off some of the projects through some really good case study videos as well. And you'll see I've included a link to both of those on the slide, which I'm sure Gemma will be circulating after. Can you go to the next slide, please, Gem? Yeah, so this is a slide that sort of just shows off some of the work with the disability focus that's been funded. These are just 3 of those projects that I mentioned, where the providers were sort of reaching a range of conditions. So you can see who the providers were, you can see the range of conditions that were catered for. And as I say, you can find out more about these projects and others by taking a look at the report. Next slide, please, Jem. So, as well as Active Sussex granting funds through the Together Fund, there have also been national partners who have been given funding by Sport England, also as part of the Together Fund, to deliver physical activity projects targeting disabled people. So far, 25 different organisations have delivered projects primarily targeted at disabled people across England. Some of these were organisations who work directly with disabled people, so Disability Rights UK, Willpower, and then others are charities or governing bodies that are targeting all 4 priority groups, including disabled people. So I know one of those governing bodies, for example, a British Judo, and then there's charities like Active Communities Network who have put a lot of funding into disabled sport as well. In total, 424 projects have been delivered by these 25 organisations, and 1.64 million has been invested on projects targeted at engaging disabled people in England. Unfortunately, we're not able to get a breakdown of that for Sussex, which is really frustrating. But this is something that we've sort of fed back to Sport England and requested be available going into phase 4, because from our point of view, it'd be really good to know who those national partners are engaging with. In phase 4 of the Together Fund, some of those national partners and perhaps a couple of others will be receiving more funding as well. And as soon as we know who they are, we will update you on that. At this stage, many of them will still be applying for the funding. So we don't know who they are yet. As well as the Together Fund, which has mainly been focused on adults, we've also been allocating funding through our Active Sussex Children and Young People's Investment Fund. So this has had a very similar emphasis looking at inequalities, and the main focus for investment from April of this year will be reducing inactivity in targeted groups that suffer from inequalities. So in the first instance, this will be sort of identified through the income deprivation affecting children index, free school meals data, special education needs and disabilities data. And for more information on this, we can share the contact details of our colleague Andy Wright, who I think is on the call actually. I saw you pop up earlier, Andy. So he oversees this particular pot of funding, and so if you're interested in finding out more information on this, just say hi to Andy in the chat. And finally, there's also an opportunity to apply for some funding through the Sport England Queen's Platinum Jubilee Fund. Again, this is very similar to the Together Fund in that the aim is to use physical activity and sport as a means of sort of bringing community together and targeting inequalities. Awards are given to the value of between £300 and £10,000. So it's the same as the Together Fund that we have. There is a cap of £10,000, and funds are available for project costs such as facility hire, coaching, and even small capital improvements, which isn't included in our funding, but is included in the Queen's Platinum Jubilee Fund. And again, the primary aim is to sort of help inactive people or less active people become more active. They're particularly looking to support projects working with people located in areas of high deprivation, and particularly looking at areas defined by the indices of multiple deprivation 1 to 3. And we've included the link to the postcode checker on the slide as well, so you can check that out for your area. So yeah, these are just a few of the funding opportunities that are currently available that we thought were sort of most relevant to this session, but there are other pots out there. There are other pots from Sport England. There are other sort of funding opportunities. Obviously, you've just heard about one of those as well. So if you are sort of interested in any of what I've discussed in the first instance, please just drop me an email and we can send you some more information on that. I would say for the Queen's Platinum Jubilee Fund, it's best to send those inquiries straight to Sport England, as we don't actually have anything to do with that funding pot. But yeah, happy to help in the first instance if you just want a little bit more information on that. So I think that's me finished, Jem. If anyone has any sort of questions on that.
Thanks, Ross. That was great. Yeah. Does anyone have any quick questions on anything that Ross or Andy's on the call as well around the CYP stuff?
Oh yeah, I was just interested on the fund for the Jubilee. Is that something that could potentially fund a sport festival, or is that not going to come within that?
I'll be honest, Loretta, I don't know is my answer to that, but very happy to try and find out some more information to see if that sort of thing has been covered. Yeah, I can chat about that separately with you if you like, and we'll try and get a quick answer to that from Sport England.
Lovely, thank you. Yeah, that'd be really interesting. So obviously that would be helpful for this year. That'd be a nice quick way of getting the funding. Thank you.
Yes, please.
Hi, Chrissy.
Hello. Can Ross send me his email details via yourself, Angie, because I just can't get it down quickly in the chat room. But I would like to know if I'd like to apply to study to do some chair-based exercise to music training. I wonder if that's covered by Ross's organisation, Active Sussex, and also again for continued funding for getting into these venues so I can actually get my classes out to the people who could benefit from.
Yeah, so the short answer is yes and yes to both. Venue hire is included, and also training can be included in the funding as well. It's actually a really good opportunity, we think, in phase 4. Another thing that Sport England want from us on this funding is more so than the first 3 phases, which was more about looking to recover from COVID. For phase 4, they want to look at that sustainability aspect of it. So where we can sort of show that we're providing sort of training to the workforce as well. And what we'll do is link you in with our workforce, our strategic workforce officer, Nick, who's on the call as well. It's probably worth him being part of that conversation as well around any training needs. And then we can look at where we might be able to include this in some of the funding.
Great, thanks very much.
Thanks, Ross. If anyone has got any more specific questions for Ross or Andy, we will drop emails and you can follow up, as I think it would be great to get on to just providing a few more updates and then allowing any partners to update as well. So So yeah, from me, I just want to give a couple of kind of updates that might be relevant. And as per the forums, like I said, I like to give a chance for people to tell us what they've been doing. And I know I sent an email out beforehand just to kind of maybe focus that around what's going on and well, if anything's particularly changed, and obviously what next. Don't feel you have to provide an update, but if you do, just pop your hand up at that point, and we'll obviously allow you to provide that update. Also, if you want anything specifically sent out with a follow-up, then obviously send that over to me via email. So first up, I want to just let you all know that we are really close to getting a date for our Sussex Disability Sport Conference. We're hoping that it's going to be held the week commencing 21st of June, probably the Tuesday, the Wednesday or the Thursday. So we will keep you posted on the exact date as soon as we've got the venue confirmed. But I'm really excited to share that we're going to have Fabienne Andre as our keynote. Fabienne is a Great British wheelchair racer, but she's also a physio assistant in the NHS. So she comes with kind of experience both from a personal level of moving from someone that was completely inactive to starting to swim based on kind of rehabilitation needs, and then from swimming moved into wheelchair racing, and also as an assistant physio sees it on the other hand of having people come to her and then trying to help them and support them to be more physically active. We've also got some 3 themes that we've identified, which is based on conversations we've had previously with network members on things they want to focus on. So we'll look at women and girls engagement, which we looked at in 2018. So it'd be interesting to see if and how we've moved forward with that. Thinking about changing the narrative around communications, and also thinking about how disability sport is shown in the media and local kind of media outlets, and also thinking about how we work and connect with education and statutory agencies. Also, we've just we put out a survey in the recent disability e-news and update around the Euro 2020, Women's Euro 2020. We've got an opportunity for running free activity using football as a tool. So if you haven't seen that, I will send this out again, but do fill out that form because it's a great opportunity to get some activity going for people aged 16 plus with a disability. And thirdly, from me, I just want us to highlight we've got some trustee vacancies coming up. We're particularly seeking individuals with certain skills and lived experience. And I will again share the details with you. The recruitment pack isn't quite out yet, but we are pleased to highlight that we're going to have a Meet the Trustees session on Tuesday the 3rd of May, 5:30 to 6:30, so you can come and hear from some of the board members that are currently part of the trust, and ask them questions about their role. So again, I'll send you information and a link to the form should you be interested. So I'm now going to pass over to Nicola, who's just going to give a few updates, and then she's going to share her screen with a video.
Well, thank you, Gemma. For those who don't know who I am, but I think most people do by now, I work for Activity Alliance. I'm one of our strategic partnerships advisors, and I cover the South East region. So yeah, I've got a few things to talk about, a couple of things from us, but one kind of to share all around the theme of children and young people, which is quite nice and neat. So hopefully some of you might have seen, it was not last week but the week before, the Office for Health Improvement and Disparities, formerly known as Public Health England, published their Chief Medical Officer's Physical Activity Guidelines for Disabled Children and Young People, which is a nice, neat title for everyone to remember easily. It can be found on the government website, but essentially it's the first piece of guidance that we've received about how much activity children and young people who are disabled should be doing. And it's a really exciting piece of work, actually, because it's been co-produced with partners, so Sport England were involved, Disability Rights UK were involved, Sense, a whole host of other partners, but most importantly, it was co-produced with disabled children and young people themselves. So not only does it give us the guidance of how much activity they should be doing, but also kind of sets the standard as to how we should be producing this work and how we should be kind of moving forward with what we're doing ourselves. So they worked with 233 children from a whole host of different impairment groups, 70 parents and carers, and 30 healthcare professionals and educators. So yeah, it's very much evidence-based and importantly co-produced. And the one takeaway that the young people really wanted people to have from this piece of work is that equality, inclusivity should be at the heart of this document, this infographic that they've created, and should be at the forefront of any messaging. So please do have a look at it if you haven't had the chance. There is, as I say, an infographic. There's a kind of the methodology piece behind it if you want to go into the kind of deep dive into the detail. But yeah, just the piece knowing that the benefits of physical activity is there as well. So do have a look at that. The second thing is something from Activity Alliance and our partners. So last week we released a set of PE activity cards for teachers and school staff, and these cards are full of ideas of fun games and activities to help teachers, support staff, anyone working within schools to provide more inclusive and accessible school sessions. So there's 6 cards. They're focusing on different things, each 6 of them. So the first one's on fundamental skills. The second one's around inclusion guidelines. Third one's on invasion games. Fourth one is net, court and wall games. Fifth is strike and field skills. And the last one is warm-up games. So they feature guidance and tools that have been kind of put together from the inclusive PE programme that we've been working on over the last few years with Sport England, and include Youth Sports Trust's STEP tool, and it suggests how we can make activity and adapt activity to suit people's kind of levels of ability and their specific impairments. And my favourite thing about them is in one of the corners, they've got a section that encourages pupils to really challenge themselves and work together to adapt games. So again, if that's something that be of use to you, do have a look at those. And the very last thing that I wanted to talk to you guys about was our Who Says campaign. So I don't know if anyone remembers, nearly 3 years ago now, we did a campaign called Who Says, which is challenging negative perceptions around disability and inclusion in sport. And we're back, we're bringing it back next week. But this time again, it's all going to focus around children and young people and changing attitudes towards disabled children and young people in sport and activity. So we're bringing out 4 different films, which each explore a negative perception that can impact a disabled child's opportunity to be active. And yeah, each one kind of brings some upbeat and kind of jovial insight from a mixture of disabled and non-disabled children and adults. So keep an eye on our social media channels over the next week, well, not this week, next week. So you can have a look at them, and if you kind of can reflect on any of them or share some narrative that kind of you feel kind of can really kind of showcase what we're trying to explain in the video, please let us know, because we'd love to share that as well. What I do have for you now is a quick 20 seconds, so don't blink, teaser video, just to kind of give you a bit of a feel for what's going to be part of the campaign, really. So let me just optimize this. Well, hopefully that's working for everyone.
No, I'm sorry, I do not agree with that.
Yes, they can! Hey! Wrong. I want to be a boss. Nonsense.
Are we done yet? Hashtag who says?
Brill.
No, I'm sorry.
Just keep playing unless I stop. So yeah, I love that. I love the "are we done yet" at the end, which is my favourite part. And we're now sending all of our internal emails. Have we done yet? At the end of everything, just because it's so fun. So yeah, really looking forward to that. Please do have a look and share them if you see them on our social media channels.
Dates. Yeah, if there is anything specific, any events coming up, any other further information, then just send it over to me and I can send it through to the attendees for today, and also we can include it in any disability e-news or update to the network. So just keep us posted. So all that leaves me to say is thank you so much for attending today. Thank you to Richard Shenton for coming along and talking about the funding that's available. And like I said, hopefully we can find some recipients of the funding. Thanks for your input into the discussion. I think it was great to hear some of the work that's happening, and also kind of some of the challenges that organisations have been focusing on and undertaking solutions for. So really useful conversation, thank you. If there's anything else, like I said, just feel free to kind of contact me by email, and we will, as we said, we're recording this, so hopefully those that couldn't attend today can listen back. So thanks once again, and I look forward to seeing you either tomorrow at the This Girl Can Forum if you're attending, or a future event. Thanks everyone, take care.